Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you this morning. And we are both honored and delighted to have Mayor Quinton Lucas as our guest this morning to help answer questions and talk about masking in Kansas City and things that are going on in the Missouri side of our bi-state area. First, we're going to turn to Dr. Dana Hawkinson, the Medical Director of Infection Prevention and Control, Hawkeye. So, dude, our numbers were kind of awful over the weekend, and how did things go overnight?
They're still bad.
They are bad.
There will be minor fluctuations, probably 5 or 10 here or there. We still have 138 total patients in the hospital, but of that...
From COVID, to say.
From COVID.
Yeah, we have like 800 patients altogether.
Yes.
138.
So 138 from COVID who really shouldn't be here for any other reasons. But 93 of those are active COVID infections. So 44 in the ICU, and 23 of those are on the ventilator. So a very high proportion, number one, in the ICU, but also on the ventilator as well. And again, 45 that are in that recovery period, and 5 of those patients are still on the vent. So if we can get them off the vent, that's great, and we certainly would like more discharges as well. Unfortunately, our partners in Hayes continue to have increasing numbers and high proportion of their hospitalized patients. They have 40 COVID infection patients in the hospital.
Crazy. I'm telling you, hats off to the Hayes team, because they're really having to bust their tail right now, because that's a lot. That's a lot of COVID. I mean, their normal census is around 85 to 90, and so for them to have 40 COVID patients, and their census is pushing higher usually in the winter, around 120 or so. But that's a lot of COVID for Hayes, Kansas.
Yep, and 34 of those are active. 6 in that recovery phase. They do have only 2 on the ventilator, which is a good thing, but they did have an overnight death as well.
So COVID is hard, and it's hard throughout our community. Mayor Lucas, let's turn to you now. How are things going from your standpoint in Kansas City?
It's a challenging time. I worry about my colleagues all around our states, from Hayes, Kansas to St. Louis, Missouri. We are seeing cities large and small dealing with the COVID crisis. Here in Kansas City, we continue to try to give and roll out as strong of recommendations as we possibly can to make sure folks know that it is imperative that you mask up. Folks know that it's imperative that you avoid large groups, that you change Thanksgiving plans. I don't like to say cancel, but just do them in a very different way, virtual. But then to also make sure that people are taking it seriously. I think over the last several weeks, in many ways, thanks to the advocacy of you and your peers in the medical profession throughout Kansas City, we have seen more people in our region take this seriously. But we all recognize we are not out of the woods. We need to change the way we're addressing things. We need to continue to fight the spread of COVID-19.
Boy, I think that is so true, and I appreciate your pointing that out. And, the rules of infection prevention control are still the way we can bend the curve. The more people that do that, the more we can bend that curve. I was pleased yesterday to see the number in Kansas City of new positives was 850 and not 1,200 again. Cross our fingers and hope that one day does not make a trend, but hopefully that'll continue. And I do want to say thank you, because I know your advocacy, you got out in front of this early and often, and that has meant everything to those of us here in the medical profession trying to wrestle with this COVID demon, which is out there and inflicting so many people. And it's all about following those rules. And I was down in, my wife and I, it was our anniversary, we took a trip down to Crystal Bridges in Northwest Arkansas. Arkansas has a mask mandate. And their numbers are about a little over half of what they are in Kansas. And you can see it's a lot better. And came back through Missouri, and we stopped in one town to get gas. And this town, I was born and raised in Missouri and spent a ton of time growing up in the Ozarks. And so we were about halfway between the border and Kansas City, and stopped in one town, and went to the gas station and filled up the car, and we were going to go inside and buy some water and some snacks. And nobody inside the convenience store had a mask on. And there was a line to go into the women's bathroom that was 6 people long, people standing right next to each other. They're all just talking and acting like nothing was going on. And you think, folks, do you not realize that this is burning through your community? I said, okay, we're going to go down to the McDonald's down the street. We drive down to the McDonald's down the street to get a soda and some fries or whatever. And we go up to the door, and the posting at the door says, the inside of this restaurant is closed because of COVID-19 in our community. I thought, what a juxtaposition. 2 blocks apart. The inside of McDonald's you can't get into because it's closed. Only the drive-thru is open. And the convenience store is open, and it's just people in there acting like it was any other day. And it's not like any other day. And the only way we're going to beat that day is to follow those rules of infection prevention and control. So thank you, Mayor, for all that you're doing and all that you've advocated for. We feel it here in the medical profession. You're right. We're trying to band together to make sure everybody knows what's going on, make sure we constantly get this message out to everybody who listens with us that masking and social distancing is the way to bend the curve. This virus is real, and every day there are a lot of people who die from it. Make sure that people understand that there's proof. Let's first turn and see what questions there are from reporters this morning.
Hey, good morning. Cody Holyoke, Channel 9.
Hey, Cody.
Hey, how do we, and I asked this question for months, but how do we hammer this home to the public that this is still a major issue in our community? I know, Mayor Lucas, you talk about the strong recommendations and keeping those as strong as possible. How do you add teeth to that? Or what is the magic cure-all to try to get people to understand, especially as we get into the holidays? We can say the CDC recommends you stay at home, but so many people are going to be going to KCI and going and traveling for the Thanksgiving. So how do you try to reach those people?
Mayor Lucas, and man, I want to know what that magic cure-all is, because if you do, we're going to import a little bit right here into the hospital.
Well, that's exactly right. I mean, first things first, I think doctors have some knowledge with how to make people be very serious sometimes about certain issues. It's something that I know you all have to deal with, not just on this issue, but others, telling people, in essence, to take their medicine. That's why the phrase doctor's orders is something that we've all heard before. In terms of what we can do from the local government side, there are a few things, and I think they're having some effect. First of all, you let people know that these preventative steps matter. It is important that we get studies like the one out of the University of Kansas that noted the efficacy of mask mandates in keeping people healthier. It's important that we have studies like the one out of St. Louis recently, I think SLU Medical School, that did a very similar one. Those are the sorts of things that we tell people, just wearing a mask can make a difference. But more importantly, I think, unfortunately, you sometimes have to share some of the challenges we're facing and some of the very preventable challenges. Not only do we hear tragically about the fatalities that we've faced, such as 2 Kansas City firefighters or fire department employees who died just this weekend, but you also have to share how difficult the treatment is sometimes as well. Some people that will walk out of the hospital will still have an experience of 2 weeks, 3 weeks, 4 weeks before they're back, and then we don't know what the long-term challenges are. So I think it continues to just be an incredibly educational, step-by-step process. Another thing that I know I've tried to do is to remove the politics to the fullest extent possible that we can, and saying, I get challenged with this sometimes. There is no mayor in America who wants to cut tax revenue. So there is no glee in issuing orders. There's no desire for any control. What we're really trying to do is simply say, these are steps that are necessary to keep our community as safe as possible. And we're trying to be as narrowly tailored as we can in those steps, and really just sharing information time and time again. Repetition sometimes does work. Information sometimes does work. And reality, in my opinion, really does work with people long term.
Well, I think that's right. And to me, it's about truth over lies. And, we have strove on this program to constantly tell the truth in a very calm, measured fashion, and not to flapjack. You know what a flapjacking is, right? Flapjack is when you flap your arms and you jack with the truth. That's flapjacking. We try not to flapjack on this program, and rather just kind of tell it to you the way it really is. And what we're telling to you, we've been telling consistently, Cody, and what I just want to say, I want to say thank you for being you listen to our program a lot, and to all the reporters who have been trying to get this message out to our community, we say a big thank you, because, the truth is that without people having information, honest information, not people who are making up facts, I am astonished that people want to believe in made up facts instead of believing in things that are true. And what is true is the number of COVID positive patients in this hospital. The mayor's point, people, they die from COVID, but they're also long-term injured from COVID. Just go back to last week's program with Anil Garmarkar. We can't say it any better than Anil did. Anil had the virus back in April, and he's still dealing with the repercussions. His life may never be the same from that. You don't want to get COVID-19. And I know a lot of people get it and they're asymptomatic, and that's great. But a lot of people get it and they're not asymptomatic. Yep. And in fact, there's 140 of those people in this hospital right now, Hawkeye.
Yeah, no, and there's a recent clinical infectious disease publication, which was one of our major infectious disease peer-reviewed journals, and it showed the proportion of patients that even when they leave the hospital and for 2 and 3 months, they have distinct changes on their x-ray or their CT scan. They have trouble with the gas exchange because of their lungs. So these long-term problems continue, and it's not just a couple weeks sometimes, but it can be longer. So it is a very devastating disease acutely, but also in that recovery period as well.
Yeah, and people who have politicized this are just, I think that's just a lack of a moral compass. This is not a political issue. This is a real life and death issue, and it doesn't care if you're a Democrat or you're Republican. And I don't care which side of the aisle you're on or how you politicized it. This virus does not discriminate. And I think that what we have to understand is that we are all in this together. And much more like 9/11 than 2020, what we really need to do is say, united we stand, and we can beat this if we just take care of each other. And there are examples of that all around the world where people have done this successfully. But the first thing is they have to decide they're going to be in it together, they have to believe in the science, and they have to be willing to try and follow the rules of infection prevention and control. So Cody, there is a magic lever, and the magic lever is called masking, distancing, staying home if you're sick, taking care of each other. That is the magic lever. Next question.
Good morning. It's John Pepitone over at Channel 4.
Hey, John.
I have a question for the mayor, and then I have a question for the doctors, if I could squeeze that in as well. I wanted to ask the mayor, there have been reports that there might be legal challenges to the newest restrictions that the city has put in place. And I'm wondering if you think that you're confident that the public health orders would survive any legal challenge by businesses.
I'm absolutely confident that the public health orders would survive legal challenges. This has been tested repeatedly, not just in the law of Missouri, but also throughout the country. Last week, a number of St. Louis County restaurant owners sued Dr. Sam Page, the county executive in St. Louis County, for their orders that had closed indoor dining. Their TRO, which is a temporary restraining order request, was dismissed by a St. Louis County judge. There were lawsuits in St. Louis County in the spring over gym closures and restaurant closures. Those were all dismissed. The county has prevailed repeatedly. You may know closer to home, Jackson County, Missouri was sued by one of the local school districts about capacity of football games. Jackson County, Missouri won that lawsuit. And so I know that folks want to make sure their voices are heard. They have a right to resort to the legal process, but we have every confidence under the laws of Missouri. I know a little about the laws of Kansas as well, that these orders can be upheld. It's something that is largely foundational to the public. A Supreme Court justice, I won't go too long on law professor land, but said some time ago that the Constitution is not a suicide pact. We can have reasonable public safe and public health orders to make sure the people of our communities can stop things like infectious spreads. And I would even point you to history. 100 years ago, 100 years plus, when we saw the influenza epidemic, there were mask orders at that time. There were quarantine orders, many of which actually spawned some set of litigation, and lots of those cases were dismissed, and the jurisdictions prevailed. So I'm confident that we will be able to prevail in any of those. We don't want to get into a legal fight. We've worked hard to try to work with businesses as much as we can. I'm very proud of the fact that the city of Kansas City, Missouri has provided more than $3.2 million in small business grants through CARES Act funds, particularly those in Clay County and Jackson County. We're still working to get funding in Platte County, and that's the way that we're trying to help businesses from hospitality to restaurants and everyone to make sure that they can survive through this pandemic.
Great. You had another question for us?
I did. I know Dr. Fauci has talked about how the patchwork approach hasn't worked. All these local jurisdictions establishing their own rules hasn't been working. And I know here in the metro area, the core four has tried to get on the same page, and largely with these latest restrictions, 3 out of the 4 are fairly similar in their measures. But I'm wondering, we still have Johnson County as the outlier. They've got a lot of exceptions to their rules that may not be meaningful, if I'm interpreting what Dr. Stites has said previously correctly. I'm wondering, is it better from your perspective as healthcare professionals? Is it better for everyone to get on the same page in a region, even though that lowest common denominator may set a higher standard than you would like? Or would you prefer the more meaningful measures, even though you might have a neighbor who's continuing to fuel the spread?
I try and answer that as best I can. Here we go. And I'll be curious to see what Mayor Lucas thinks about that as well. But I think that ultimately the rules of infection prevention and control don't care what your state line is, your district line is, your city line is, or any of that. You're right. The virus does not care. So if people don't follow the rules, then we're going to have more spread. And to the extent that you work to keep things safe, we can bend the curve. University of Kansas proved you can bend the curve on a major university, end up with a lower infectivity rate and a number of people being positive than the surrounding community by de-densifying a campus, going to online learning, keeping the school open, and doing doing testing. I mean, I think it's a shining example of how when you follow the rules, you can do it right. And you can keep your community open. None of us here at the Med, so first of all, it's not our jurisdiction, not our bailiwick to try and talk about it really, but none of us want to see the community closed down altogether. No. What we're saying is you can keep it open safely, just as they did in Springfield, where the best example has been the two hairdressers, both positive, treating people, and they didn't know they were positive, but turning out they were positive, treated 140 clients over 1 or 2 days, and found that there was zero transmission when everybody wore a mask. If you just follow the rules and wear a mask and try to keep your distance, but wear the mask, you can do a darn good job here bending the curve. The proof is indisputable. The other source of proof is right here in the hospital. We have 145 or whatever the number is today, COVID patients or COVID recovering patients. How much spread do we have in our hospital between the COVID positive patients and the actual caregivers who are taking care of them? The answer is we don't. And the reason is because we wear masks and we follow the rules. So the answer to your question is, darn, follow the rules because it works. And we're at a time of crisis in our state and in our country. And we have a crisis because we don't want to do the most simple thing. Follow the rules of infection prevention control. So does it hurt when one area or one group of folks decide not to? You bet it does. It hurts all of us. And you see, that's a struggle. And that's a struggle I have every morning when we come in, we see these sick folks here. Because all you have to do is follow the rules. You can't run a red light. You can't drive your building into your car into a building. You can't decide to smoke in public places now, all because it's healthier if we follow the rules together, and it keeps each other safe. Mayor? I can't hear him.
Ask if he's muted.
Hey, Mayor, we think you're muted. I know you're saying something smart, so yeah, make sure you're unmuted.
All right, am I back?
Got it.
Yet?
Yep, we hear you.
Right. So one of the areas of interest that I had from the spring was when New York, New Jersey, and Connecticut said, there is just too much overlap in our community. Try as we might with every stay-at-home order known to man, we have to coordinate. I think that is the same story with what we're facing in the Kansas City area now and a lot of other metros. That's why we've tried so hard to make sure that we do work together. To answer John's question, yes, in a perfect world, everybody would agree 100% on things. Look, we will continue to try to push it that way. I actually thought it was very intriguing that you had as distinct political divisions as Clay County, Platte County, Jackson, and Wyandotte. And actually Johnson County's health department did join those recommendations that at least got in the right direction. We're trying our best through disease spread mitigation to make sure that we do work together to have consistent advice, consistent recommendations. But no, it doesn't make it any easier when there are disparate viewpoints. But I think as time has gone on, at least we are hearing consistent advice, even if it isn't always required. One thing that I was proud of the other day was that we saw, I think just yesterday actually, that the city of Clinton, Missouri, a place that some of you watching may be in or others who drive down to the Lake of the Ozarks may go through, is issued a mask mandate the other day as well. I've talked to mayors from throughout Western Missouri, including St. Joseph and others that have said, we often try to at least align with your rules to the extent possible. So we are working together. We would always love even more cooperation, but at the same time, that won't limit us from doing what's right. My primary goal always is to say, what can I do to keep the highest number of Kansas Cityans safe? And the true story is, that means that I have to care about how we're keeping people of Upland Park safe, and of Liberty, and so many other places around us. And we'll continue to push that, not just through our own orders, but through the conversations with governors of both of our states, Governor Parson, and we have political disagreements sometimes, but he has been a great listener in terms of some of the steps we need to take. I know Governor Kelly on the Kansas side has done the same. We'll keep pushing all of those for as long as we're dealing with this crisis.
Thank you. Other questions? Jill?
I have a couple. Ellen McNamara with KCTV5 wants to know, what will the vaccine distribution in Kansas City for the general public look like? What ideally would you do? The city of Shreveport, Louisiana, for example, is using a massive flu vaccine drive-through event as a test run for the COVID vaccine.
Mayor, thoughts about vaccine distribution in Kansas City, and we can tell you from our standpoint how it's going to look as well.
So first, I will trust the doctors on the real rollout points. A few things that we've learned about Kansas City and more broadly Missouri's plan are the following. Dr. Randall Williams, our director of the Department of Health and Senior Services in Missouri, will largely kind of govern in some ways what the practice will look like in the state of Missouri. They will be, as far as I'm aware thus far, sending the vaccine to certain areas of the state that can handle the storage needs for it, and then having a laid out process in terms of who's getting access to the vaccine and different levels, right, with priority to those who may be at greatest risk, right, then those who are frontline workers, first responders, and then on to the general public as well. Something that I will say is a hope and dream of mine. Things aren't always distributed in the way that we would like here in the cities when our state capitals are controlling it. I mean that as respectfully as one saying that line can. And so my hope will be that as the rollout takes place, that it is fair, and I think it does recognize the fact that a lot of our primary acute medical institutions are in Kansas City, both Kansas City, Missouri, and Kansas City, Kansas. It will take into account that many people come here for treatment. Many people come here when sick with any number of ailments, and so that there is a population demand and necessity that in some ways may be greater than even the percentage population of Kansas City and the state of Missouri. I hope that's what is balanced when Western Missouri, or when the state of Missouri more broadly, starts its rollout. We'll continue to work with the governor's office and Dr. Williams' offices to make sure that that can be done in as fair a process, as efficient a process as possible, but one that also recognizes, I think, the impact and the importance of cities, St. Louis area and Kansas City area and Springfield, in terms of treatment and healthcare provision in Missouri.
And I think there's so much that we don't know about the vaccine rollout, but I think we've learned a lot from how we rolled out remdesivir. Well, first of all, and how we roll out the influenza vaccine, how we've rolled out remdesivir, how we've rolled out monoclonal antibody therapy. And I think we'll get allotment. You know, I think if you dig into it, you can find that there's some really good information out there about what some of the planning is. And I think that the first thing is the Pfizer vaccine is going to be a little bit more of a challenge because of the temperature requirements and the cold storage and how long it can have a shelf life. All of those things are going to affect how you roll it out. When you get down to the AstraZeneca vaccine, which barely has to be refrigerated, if that providing all those get through, I mean, Moderna is much easier than Pfizer's, and then AstraZeneca is even easier than that. And so as you look at that, that's just going to change the dynamic of how we distribute the vaccine. Because with the Pfizer one, when you have to be at 70 degrees and colder, there's not a whole bunch of storage places around that. So you're going to have to go to like research universities and places that have a ton of cold-free storage and some food processing plants and things like that. Say, what can we do to help do that? So, and I'm not saying we're going to use, but the vaccine and food processing plant. Right. I'm just saying that there are places that have those kind of freezers. There's some technology you're going to have in order to get that distributed. So that will affect it. What we know is that wave 1A is going to be to the most vulnerable population, which are nursing home residents and also frontline healthcare workers. Frontline being defined as people who are routinely taking care of COVID patients. 1B goes to, again, another group of very at-risk patients who have significant comorbid diseases, and then all essential healthcare workers as well. well as first responders. And then you get into wave 2, which is going to be people with other chronic diseases, and wave 3, which tends to be the general population. Depending upon how many doses are available will largely dictate how fast we can get that vaccination out. The other thing out, and we're asked this on a fairly regular basis, are you going to require that of your staff? And the answer is we're not. And the reason we're not is because this drug will have an early use authorization, but it is not technically FDA approved yet, and it won't be probably for a year or two while we look at all the post-marketing surveillance to make sure that the vaccinations are truly safe and that they're effective. So there's a lot of stuff that just got packed into that statement, but I think if we need to, Hawk, we can probably spend a little time with that reporter, especially talking with you and other members of our vaccination team who have been working on this for months now. Yeah,
absolutely. A couple quick points that, I was asked a question earlier, why would you want to take a vaccine that has 70 to 90% efficacy versus something that has 90 to 95%? Well, I think the important thing to know is that several companies are hopefully going to be releasing their vaccine early. We also know that there are several companies who are still doing their trials. With the amount of people that have to be vaccinated just in this country alone, you need those companies to create those supplies because just one company cannot do it. The other thing to Mayor Lucas's point is equity. Equity is going to be vitally important here. We know that there is a large proportion of essential workers, frontline workers, healthcare workers, that are in those minority populations, and it is extremely important. We have seen how the minority populations have been hit so devastatingly hard by this disease in hospitalization rates and death rates. So it's going to be extremely important to roll those vaccines out to those vulnerable populations as quickly and as soon as possible.
All right, another question, this one for the mayor. Are you going to require city workers to take the vaccine?
That is something that we have started discussing. I would think that there will be a distinction in the types of city workers that you have. I would hope that everybody looks to take the vaccine. I know there is some discussion in the Missouri legislature. I don't have the blessing of serving there, and I don't know if I have the wish either, that there may be a prohibition on requirements of people to take the vaccine. If we are subject to such a thing, then we will not require folks to take vaccines. I would hope, however, there would be an exemption for those who deal and interact with the public a great deal. The aforementioned frontline workers, followed by our first responders, are folks that will have an incredible amount of interaction with the public, and that we don't want to be conduits of further spread of COVID-19, particularly when a vaccine is available. It will be my strong preference that all take the vaccine when available, not just our city employees, but others. But at this point, it doesn't seem as if the political winds will allow us to necessarily make those types of requirements. But we will make strong recommendations. There are other things we can do, such as certain types of bonuses or some incentives to taking the vaccine, perhaps better access to any number of things, job duties, et cetera, if the vaccine is taken. And that's probably the step that we would initially try to take if we're preempted from being able to take such a bold step as requiring all to take it.
Mayor, I understand you may have some slides, or if you want to call on those slides and you take a look at that, we can pop them up here.
Yeah, no, I'll do the slides. As you all know, I was a professor of I got into this business, and so get a chance to talk about a few of our legal rules, which the joy of this is that these are not just Kansas City rules, but these are also the rules in much of our region. And for those who are watching and don't live in Kansas City or Wyandotte County or Clay or Platte or Jackson, these are strong recommendations as well. The most important recommendation I think we have is that indoor gathering limit to 10 people. What we're saying in that, and I get people who ask me all the time, by the way, is 10 a magic number? The short answer is no, it's not. But what we have seen from other jurisdictions, from medical recommendations, from advice nationally and globally, is that if you can limit the number of people that you're around, if you can actually have a smaller group with which you're interacting every day, then you can help limit the spread of COVID-19. In many ways, I would prefer that you stay with the same kind of limited group of people each day. However, we recognize sometimes you may get outside of that space, but 10 is an acknowledgement of hopefully you have a small group with you. Hopefully it's not many different households represented, and that's what 10 is about. Of course, the most important part of that would be that you should greatly rethink what Thanksgiving will look like. The big family event is not a necessity this year. It's really something you should not do. Instead, think of ways that you can visit with folks virtually, on the phone, and curtail those types of activities. I personally plan to do the same. We also have a closure order for restaurants, bars, and event spaces. The genesis of this is that we had very large uncontrolled spread from folks in their 20s and 30s who were more than 50% of our new cases in Kansas City for several weeks. That was incredibly challenging for us. As all may recognize, the later the night gets, the more people may be drinking, the more some of the rules and inhibitions go by the wayside. So that's why we really look to do that. And then the last one I'll touch is actually a mask requirement that is not just indoors, but outdoors when social distancing cannot be maintained. Since Kansas City, and Kansas City, Missouri was the first of our local jurisdictions to issue a mask order, we have seen that mask compliance has increased dramatically. That is an outstanding step for us. But we wanted to make sure that it was something that was indoctrinated for everybody. You know, we don't want you to ever be too far from your mask. And so just making sure that if you're around folks, if you're going to be in a certain situation, you have your mask with us. I know sometimes, you know, you make it, we want to make sure you're not caught without it. And so that's why we have that mask mandate that also extends outdoors. A few other things that we wanted to talk about was enforcement. I get calls from businesses all the time that say, well, are you guys being fair? We did the work, but others are not. Well, we do have heavy enforcement in Kansas City, and I know our partner jurisdictions. The health department was out, our division of regulated industries, which oversees liquor laws. We're making sure that people are following the rules because that's fair for us and that's in the best interest of public health. Earlier this year, we did have to close a few businesses that were not in compliance with the orders. They reopened, but pursuant to public health department advice. This weekend, we were out and we'll be out again this weekend and Thanksgiving Day, et cetera, Thanksgiving night. And we'll be looking for those types of events and parties that are having these uncommissioned giant gatherings. And here's the deal. I know people ask me sometimes, are you kicking down grandma's door on Thanksgiving? And no one wants to do that. But I read a story out of Queens, New York the other day where there was I think a several hundred person party of ill repute, I may say, that the New York Police Department and others learned about. We are on the lookout for things like that. We do want to make sure that it's clear to folks that those are the sorts of things that are unhelpful for community spread. And these rules are backed by the force of law. They are based in the Constitution of our states and our city charters, and so that's why we have them. And then one final slide I wanted to talk about, and there's a lot about resources. I talked before about the $3 million we've been able to give to small businesses in Kansas City. And I know a lot of other jurisdictions, particularly Wyandotte County, I know has done that work. I think Jackson County has done the same. But, you know, what we're working with is a bit of a challenge. Kansas City itself has requested $164 million of CARES Act funding support. We received $30 million. At this point, we have not received CARES Act funding from Platte County. By the way, I apologize. The final E in Platte was left off. We're having budget challenges at the city, so I guess that may be my excuse. But nevertheless, you see that we are actually facing some real issues long-term in terms of how we can address the crisis, how we can address overtime issues for our first responders, how we can actually support businesses, how we can make sure that there's enough testing in Kansas City. For some, testing can be found through your medical office. For many others, however, they're waiting in lines at our local health department to get it. We'll continue to try to do all we can with what we have in local government, but those are where our challenges really come in terms of how we can address this crisis long term. I will be a little political now because, you know, what the heck? I would like to see our Congress, and this is my appeal both to Speaker Pelosi and Senator McConnell, is the hope that we can get some sort of stimulus support passed for our local government jurisdictions, our hospitality industry, and others prior to the end of this congressional session and prior to the inauguration of our next president. I think that is important, and it is something that cannot wait, particularly as we deal with the spread in the winter months. That's going to be a huge issue. I shared that with my Congressman Emanuel Cleaver the other day. I have a call scheduled with Congresswoman Sharice Davids on the Kansas side. We'll be talking to everyone in our delegations. And by the way, I see myself, although elected by the people of Kansas City, as a fairly bi-state mayor. And so we talk to leaders on both sides. So we'll reach out to Dr. Marshall, Senator Moran, Senators Blunt, Senators Hawley, Senator-elect Marshall, I should say, to make sure that everybody's hearing what is necessary to make our region stronger.
And we thank you for that. And I love slides. Again, it's that professorial part, right?
Right. David wants to know if you could add to the city website how to wear a mask properly. He says what he sees out in the public is people having half attempts at wearing a mask. Under the nose, on
Absolutely.
the chin.
Yeah. And there are a lot
Yeah.
of good videos out there.
Yeah, we can, and we think we have produced a few. We will continue to try to message it. But I will tell you what, and I think Dr. Stites and the Hawk, or Hawkeye rather, I'm getting the nicknames down, can tell us that the best way to show it is by modeling good behavior yourselves. So the more people see you with the mask covering your mouth and your nose, the more they see you not touching your mask all the time. Those are the sorts of things that we really ask our members of the public to be about. And another thing that is actually more helpful than you would think, I was talking to a few friends of mine, some of whom don't seem like the world's most responsible people, and they were sharing the message of how serious COVID-19 is. And I would ask you all to make sure that you're doing it. Dr. Stites and Dr. Hawkinson can certainly spread much for us. Your elected officials can, but we're really looking forward to all of you to make sure you're spreading that message about events that are happening, maybe even telling your friends if they're saying, hey, we're having a kegger in the backyard. Now, my friends don't do that anymore, but maybe you all watching have friends like that. You say, maybe we shouldn't actually do that, and it can wait till later. Maybe the big reception, the birthday party, the retirement party can wait till better days. And that's what I would love for you to try to message. And something that I know we're doing in the mayor's office is going virtual with a holiday party. I think I'm going to be making sure I get different refreshments to folks from good Kansas City institutions to each of our staff, but in a way that doesn't have us all coming together. And that's the sort of change that we can make. It's a different time, but it doesn't mean we lose each other. It doesn't mean we lose interactions. And that's the sort of work I think we need to do.
Yeah, I think that's right. And the masking thing, it's the thing that always confuses me is if people decide, well, I'm not going to wear a mask, are the same people who then complain that society starts to close down. Well, you understand that you're really hurting yourself by that. That the right idea here is you can keep things a lot more open if you're willing to wear a mask. Yeah. Because that, we know, Hawkeye, masks we know work.
Yeah, I mean, we used to say there's more and more evidence. I think you said it best now. There's undisputable evidence that masking works, and it's on the CDC website. There are plenty of peer-reviewed publications now showing the effectiveness of masks.
And I'm always stunned, and I keep saying this, and I feel like it gets traction, which means I don't say it right. But the most hottest spot and the safest spot in the country are existing in the same place simultaneously every moment of every day. And that place is the inpatient ward of a hospital, where there are lots of COVID-19 patients congregated together. That's very dangerous, except it's not. And why is it not, Hawk?
We have masking, we have eye protection. We understand the rules, distancing as much as possible unless we're doing a procedure or we need to be next to our patient for examination, things of that nature. But also maintaining good practices within the hospital with our employees, and that is continuing to be physically distanced, continuing to wear the mask in those areas that aren't necessarily right in the patient's room. So doing all of those things on a regular basis.
All right, let's run through 2 or 3 just infection disease questions. Tiffany wants to know, and a lot of people do, if you would go through one more time, once you've had COVID and completed your isolation, what is the post-infection immunity and shed, and do I still wear a mask?
Yeah.
All right, Hawk.
Well, that's difficult because I just saw a report today, again, in clinical infectious diseases. They actually documented a reinfection at 23 days after the initial one.
Wow.
Which was an unexpected result because they were just looking at how long people shed. So after you get diagnosed and 10 days after your symptoms start is when you really can get back into society and stop your isolation. But having been infected with coronavirus or having COVID-19 does not negate the fact that you need to continue to distance, to wear your mask, to not meet in large gatherings. You have to do all those public health measures that we have been talking about. So again, isolation continues for 10 days past your initial onset date of symptoms. But after that, you need to, when you get back into society, continue to do those pillars of public health that we have always discussed.
Elizabeth wants to know, has the city or the health system or the county looked at whether in-person voting might have led to a spike in cases?
Great question. Mayor?
That is a good question. We I don't know if we saw a spike that was anything different than the trajectory we were on, which was an unfortunate one, relating to the election process. Certainly, I was jealous of what we saw on the Kansas side, which allowed for greater mail-in voting opportunities. Actually, it was fairly impressive that in Missouri you have absentee voting, but many people voted early. Fear of COVID was one reason, or likelihood that you might be susceptible to catching it, which is all of us. And tens of thousands of Kansas Cityans used their opportunity to vote earlier, to vote with some greater level of distance in connection with that. You did see an unfortunate outbreak in the Jackson County Election Board. Remember, Kansas City's election board and Jackson County's are different. I think that they were able to address that hopefully well, but those are some of the challenges that we saw, but we cannot say that there was a spike directly related to Election Day itself. What that does not mean, however, is that we should just start having giant events all the time. I mean, I think part of the reason you didn't see a greater spike was not only early voting, absentee voting, and mail-in voting in other jurisdictions, but also the fact that our health department worked very closely with the election board in Kansas City, and I know all of the other jurisdictions, to make sure there was as much distancing as possible, that styluses that were used for touching electronic voting machines were discarded after each use, or people could keep them with themselves. Those were a lot of the steps we took. And at the time of our next elections, which will be in April in Kansas City, we would continue to look to follow these same types of safeguards. There's something related to that I also wanted to mention. People often ask me, how long will these orders be around? And I know I got a lot of hate mail and a few death threats and other things back when we extended our mask mandate back in the summer all the way through January. It appears that not only was that the right decision, but we'll have to extend longer. The reason we talk about masks a lot is that I think it'll be important for us to get used to them. We need to get used to social distancing. This isn't because we want this to be the state forever, but because we actually, as Dr. Stites was just noting, want to be able to keep things open. We want you to be able to shop in your favorite local store. We want to be able to have, particularly for younger people, our kindergartners, first graders, and second graders, opportunities for in-person learning where allowed. The way we do that is to make sure that we can be as safe as possible. That's wearing masks, that's washing your hands, that's maintaining distance. That's not doing things that run afoul of public health recommendations. And so that's much of what Kansas City will continue to do, whether it be a big Election Day event, curtailing the numbers of folks that will congregate for any number of events, be it the mayor's Christmas tree celebration, which I kind of like, as you might think, at Crown Center, which this year is canceled or is virtual. Those are the steps that we have to take to make sure all are safe.
It makes so much sense, and I think that is exactly right. And the more we can follow the rules of infection control, the more we can keep each other safe. And I think the election was safe, and I was impressed by how well it was done and how well it was conducted. I actually, for myself, voted early down at Union Station. That was great. And I think it will also be hard just to answer that listener's question, because Halloween and Election Day were so close together. I think the signal of any things are going to be is probably going to get lost. But let me tell you this: what I saw happening on Halloween was not a lot of distancing. What I saw happening on Election Day was a whole lot of distancing and following the rules. If people can be that diligent all the time, we will have bent the curve. So bring it on. If people act like they did on Election Day, we will bend that curve. Yep. Last question.
Kent wants to know if you might consider amending your hospital analogy with masks. He said he doesn't think that the community doubts that surgical masks prevent spread. He thinks that they doubt that cloth masks have any efficacy.
Ooh, I'm not going to amend it, Hawk, because I think there's actually really good data that cloth masks do help prevent it.
Yeah, and this is from, again, we have those good studies from the CDC. We just talked about the hairstylists and their clients.
Cloth masks.
Cloth masks, most likely. We have a new, larger study looking at mask mandates in the state of Kansas, which showed decrease in infections after the mask mandates were imposed compared to counties that didn't have it. But there are other publications and peer-reviewed publications in which they look at populations and, pretty much guarantee that a lot of those populations were not using surgical masks, but were using that 2 to 3 layer cloth mask, such as the mayor has on there. So there is plenty of evidence of that. And these are, community studies. They aren't just hospital studies. So there is good information and undisputable evidence about the effectiveness of masks.
Mayor, as we wrap up today, first I want to say, where can I get that cool looking Kansas City mask? I like that. Are those available?
You know, you can call the mayor's office and we'll help you out. Call 311 in Kansas City or email mayorq@kcmo.org. It's made by a local business, and we've looked to profile as many local businesses as we can throughout the crisis.
I'm going to send you some Mask Up KU masks that are pretty cool,
Hey.
too. It's a good trade.
Would appreciate it.
Hey, thank you so much for being on our program today. Thanks for all your leadership. Thanks for getting out in front of these issues and helping us here in the medical community. We really appreciate that. The work that you and Mayor Alvey and others have done has just been outstanding, and so thank you. Final thoughts from today?
You know, I'll say this, and actually it's on the very last question and the last point, and I am so happy you did not amend your advice. This is purely anecdotal, but as you all know, I've probably been at more events than I should have over the last 8 months, ranging from protest actions to city council meetings, all types of things. And we're doing better at curtailing those activities now. But at so many of those activities, I've worn a mask. I have not come down with COVID-19 yet. I've been able to protect my family. That is with cloth masks. Cloth masks work. They're important, making sure that you're following some of those kind of simple guidelines we have. Folks, these modest steps make such an important difference for you and your family and so many in our community. That's all we're asking for over Thanksgiving. And I want to say actually thank you to Kansas Cityans for really heeding that advice, people throughout Missouri and Kansas. And, you know, part of my upbringing, I won't go too long, but I lived in Hutchinson, Kansas for a little while as a kid. And as I've looked at numbers spike throughout the state of Kansas, throughout the state of Missouri, cities large and small, I've thought back to some of the folks I knew in Hutchinson, the people I care about and work with in Kansas City. And I've said, you know, if we can all kind of get on that same page, wearing masks, maintaining distance, then we can do a lot to flatten this curve. We can do a lot to make sure people are safer. And hopefully we can get through this crisis even faster. So thank you all for the time. Thank you for spreading the word of how important our disease mitigation steps are.
Yeah, thank you, Mayor. Thanks for spending some time with us. Hawkeye, final thoughts?
Yeah, I'd like to echo what the mayor said. It's important to understand that it's not just the masking, but it is the combination of those pillars, the masking with the distancing, the not meeting in large groups, because we've heard and we've read articles about people who wear masks, but then when they get together with the groups, the masks are coming off, and it's not 100% wearing. So it is those other mitigation strategies combined with masking, and that's distancing, hand hygiene, not meeting in large groups, all that will help to decrease the spread of the disease. And as you said earlier, nobody wants a shutdown. We want people to be able to earn a living and have incomes and put food on the table. But it sounds like the people who would be most drastically affected by a shutdown are probably the reason that the shutdown is occurring. So I think that's important to understand. Please continue to do the right things, wear the mask, physically distance, do not meet in large groups, use the hand hygiene. All those things, when combined, will help decrease the spread and flatten the curve.
Tomorrow, KU Chancellor Dr. Doug Girard is back with us, and Chris Wilson, the VP for Systems Innovation and Integration, will look forward to their discussion with us here. And we'll be talking a little bit more about how the university is preparing learning for the rest of the year. Also, Thursday and Friday, no update. Our staff we're going to take a well-earned break, and we'll be back on Monday, November the 30th. As we close today, I want to leave you with a thought. We're going to show you in a moment that a video of masking as a tool, but not as a symbol. Thanksgiving approaches, and we're all going to stay and count our blessings. And you've heard the advice over and over again. What's the best way to say I love you on this Thanksgiving? What's the best way to feel blessed? Is it to do things as we would normally do it? Or is it to be different this year? And this year is not every year, to be sure. But this year is this year. And this is a bit of a different time. As you think about your masking and how you have to socially distance to be different this Thanksgiving, remember that some ways, the best way to say I love you is to wear a mask. Because if you don't and you make somebody sick, what did you really just say? We'll be back tomorrow. Let's take a look at this video for now.
I'm a patriot and a mechanic, which means I know the difference between a symbol and a tool. The American flag is a symbol of everything that I would die to defend. This is a tool. It says nothing about my politics. I wear it to protect the people that I love. We have a job to do, and this is the right tool for that job.